It Right show, and I'm Dr. Kay Seller in the house with Hurricane Betsy Barnes, and our medical segment is brought to you each week by Mary Bird Perkins, Our Lady of the Lake Cancer Center, and today we're really excited to have with us Dr. Larissa Sweeny. Thank you for joining us. She's an otolaryngologist at Mary Bird Perkins, Our Lady of the Lake Cancer Center, and you're here because April is Head and Neck Cancer Awareness Month. You know, we always have these different awareness months. We try to highlight
We're
things.
very aware.
We're very aware, yeah. And but let's just start with the basics and just tell folks about that disease. It's kind of hard to do, isn't it? Because it's so broad.
It is broad. So head and neck cancer encompasses anything above the clavicles, these little bones right here. And so it can be cancer of the skin, it can be cancer of the lining of the throat, of the lips, of the thyroid, of the salivary glands. Your tonsils can get cancer in them, the back of your tongue, voice box. So there's a lot of different anatomical sites that have different important functions, so it is pretty broad.
Right, and of course, there's a lot of different anatomical sites, but when we're talking about early detection being the key with all cancers, I mean, are there some early signs and symptoms that you look for in general for head and neck cancers, or do you have to be more specific for the different types that you're thinking about?
So that's a great question. It does kind of depend. Some patients, the lucky ones who present with a neck mass, a lump or a bump, or a sore or scratchy throat, or some ear pain that kind of gives them an indication that something's growing, those are the ones that we are able to detect early. Some people will have voice changes, and then every once in a while someone will have a cancer growing back there and have absolutely no symptoms.
So how do they detect that? When there's something growing back there and they have no symptoms, of course, eventually they would have some symptoms, so it
Right.
wouldn't be early detection, but is that something that would be generally picked up if they were going for their annual checkup with their physician?
Perhaps the physician might note maybe a subtle change in their neck, a lymph node that seemed a little bit larger, or if they were getting scans or imaging for some other reason, or if they start getting some weight loss or some other symptoms that might tip them off to start looking.
Or maybe a dentist might notice something in their mouth or
that's
something
great.
like that.
Yeah, for sure.
Another reason to be going to get those dental checkups as well. So what are some of the causes of head and neck cancer? I mean, right off the bat, people think about smoking because that's right into your lips, but
the vast majority of our patients do have a tobacco history, and tobacco is definitely found to increase your risk of getting particular type of cancer. Heavy alcohol use can be synergistic, meaning it can make that even more likely to get cancer or get a worse cancer. And then with sun damage, skin cancer is usually the result of some sort of sun damage, not always, but most of the time. And then in the past 2 decades, we've noted an increase in HPV-related cancers of the tonsil and the back of the tongue, which is a virus that actually will be dormant for many, many years and then eventually cause the cells to undergo some sort of transformation that becomes a cancer.
Right.
So the human papilloma virus can just be dormant in your tonsils and then present.
Yes, so there's...
Who knew that? I did not know that.
Yeah, the tonsils in the back of the tongue have kind of these peaks and valleys. We call them crypts. And so the virus gets trapped in that crypt and can be there for many, many years. You're well familiar with HPV.
Yeah, with all the vaccinations
so,
for HPV.
Being a gynecologist, we're really familiar with HPV, human papilloma virus, and so a lot of people only think about it for gynecologic causes, but yes.
That's important for children, young adults.
Mucosal membranes.
Yeah, a couple years ago, the incidence of HPV-related head and neck cancer actually surpassed that of cervical cancer. So it's now more common than cervical cancer.
Wow. And is that because we're picking up things so early and getting precancerous cells because of Pap screening in women, and they're not getting it, you're not really screening in the oral region, and so when they happen, they're not picking up precancerous cells that are treated.
Exactly.
They're presenting with a cancer.
Correct. Yeah, we're working very hard to come up with some sort of screening mechanism like the Pap smear for the oral cavity and the oral pharynx, but the technology's just not there yet.
So knowing these risk factors, so is it possible that head and neck cancer could be prevented? I mean,
Yeah.
I mean, granted, if you don't smoke, you're like already like,
Right.
chalking it up.
Right. If we could eliminate tobacco use, we would eliminate a large portion of our patient population. And then there's actually a couple of vaccines out. I know now everybody's very familiar with vaccines, but there's a few vaccines out for HPV that the FDA has now approved up to the age of 45. And so it prevents the most troublesome strains of the HPV virus.
Absolutely. And we're very, that was something that we were always talking to folks about. And then a lot of families go, well, why do not my kids need that? Because it starts in childhood, because they mount a better response. And you want to, just like, when they started making hepatitis B, an infant vaccine. It was not because that we thought they were going to get it at that time. It was just to help eradicate it. And so you want somebody to get a vaccine before they're exposed to the virus. So same thing. If you're like getting
these
those
vaccines have
schedules,
years and years of
it's
studies
much.
behind them.
Absolutely.
Yes.
That's been, the
Over a
HPV has
decade.
been around for a long time. It's just that they recently started up in the age,
They did.
So, and also not just for girls anymore, but for boys too, which initially it was just, for girls. So, but yeah, lots of things as always that we can do to reduce the risk for those cancers. So now let's say somebody has one. Let's talk about treatment types. And I'm sure it varies depending again on the types.
Yes, there's a wide variance of treatments, but my role would be from a surgical standpoint. So if you had a head and neck cancer that was amenable to surgery, then we would remove it surgically. And then the addition is at our cancer center, there's myself and two of my colleagues who have been trained in robotic surgery, and there's some advantages to that, and it allows us to eliminate some of the incisions and some of the morbidity that the bigger surgeries used to carry. So that's great.
Yeah, and it's amazing. People don't realize, the robotic surgery, but you can get in tight spaces and places much more cautiously and carefully than you can even with a big incision.
Yes,
and
for
the
sure.
recovery, I'm sure, just like if it's an abdominal surgery, is also better.
It is better. Long term, we're able to preserve some of the muscles involved with swallowing and speech, and so that allows patients to have better function long term from with the use of the robot.
Right, because you've got those, special nerves and all of that stuff, and little tiny vessels in those spaces that you are working in.
Right.
So,
correct.
So let's talk a little bit about, you mentioned the surgical part, but, you're part of the multidisciplinary team, which I think anybody who's been watching the show is familiar that there's multidisciplinary, teams that involved.
Thank goodness there are, because Mary Bird Perkins does an enormous amount of research.
It really helps with the entire care. So let's talk about that as far as your specialty area.
Yeah, no, that's a great point. So because of the complexity of the head neck area and what we treat, it's really important that we do this as a team. And so we have radiation oncologists and medical oncologists, we have dentists, we have speech and swallow therapists, we have pathologists and radiologists, and then cancer navigators and coordinators, and everybody that's involved with these patients comes to our team meetings where we talk about the cases, we discuss what we think is the best treatment for these patients, both from a survival standpoint and a function standpoint, and then we make sure that all the team members involved know that this patient's coming in and are aware of them to make sure that we can streamline their care and ensure that all the boxes get ticked off and they see everybody. And nutrition is also very important. I forgot to mention them.
Right, as far as their care and recovery. So many aspects when you're looking at treating a cancer. So if somebody wants to know a lot more, let's tell them the best place to go.
Sure, there's a website, which I believe is Mary Bird Lake /head neck. And then there is a telephone number for our head neck cancer center, which is 225-765-1765.
Great. And so you were telling me before we started, you've been here in Louisiana for 2.5 years now.
Yes, that's correct.
And
you love
how
the
you
food,
liking it? How you liking
It's
it?
great. My husband and I are very much enjoying the Cajun food. And he's getting into fishing, and we're learning about the bayous and our way around. So it's been fun.
Well, you know what? We can recommend lots of places to go, things to do, and people to see.
That's
our specialty.
We love recommendations.
Yeah.
Sure.
So we can help you with that. And you're from Central Florida originally.
I am, yes. I grew up in Central Florida. I've
So
traveled.
you're okay with the heat?
I'm okay with the heat, yeah. And the humidity. It's
right.
very humid there as well. We're just on the opposite side of the Gulf. So
Yeah.
Yeah.
For sure.
We're so glad that you could come. We just really enjoy meeting every person that we can with Mary Bird because they do phenomenal. I mean, they take you by the hand through every step of anything, and so we're just really blessed that you came to spend a little time with us and share what you do.
Well, great. Thank you guys so much for including me and allowing me to have this opportunity. I appreciate it.
Well, we appreciate you being here. We've been talking with Dr. Larissa Sweeny, who is an otolaryngologist at Mary Bird Perkins, Our Lady of the Lake Cancer Center. And as she said, that website is marybirdlake.org/head-and-neck. And the number is up on our screen, and we'll put it on our Facebook page as well. So y'all make sure that check out Rocket Right Entertainment on Facebook. Follow us. We'll have her interview up there in case you missed anything. And thank you so much.
Thank you, guys.
Thank you for being here. And if you have any questions about anything with cancer, you know who to call, marybirdlake.org. And we're going to be back with Cliff Milius and Vicki Milius talking about Dreams Come True, Louisiana.
Mm-hmm.